I like girls when know the demo you. I like your type, let me flex on you. Other girls got nothing on you. Let's go to France, make I say bonjour. You know you like it, don't be shy. Check our law, let's have a good time. You know you like it, don't be shy. Check our law, let's have a good time.
The way they do me, saying I love truly. Like
hello everyone, welcome to another edition of Microbout. It's Bout Talk. It's been a while, and I want to welcome you to this edition. And I've missed you. I've actually missed being in the studio, and I hope you've missed me as well. So today we'll be continuing continuing the series of talks that we've been having for epidemic preparedness and response plan. And I know that we've been having these interactive sections for a while now, and of course I've been receiving questions off studio, and I've been answering them as well. And of course I've been also heavily involved in a lot of the activities, monitoring, providing technical advices for many states, and along the line I've learned a lot of lessons as well. I've gained a lot of insight, and those insights are what I've been sharing so far on Bout Talk. And today we'll be talking about one of the pillars of epidemic preparedness and response plan. Well, in a lot of ways, it's not strictly, it hasn't really been known to be an health-based issue, but in recent years, recent times, it has been involved and included as part of any emergency preparedness and response project, and that's gender-based violence. Like I said, in recent times, the World Health Organization have recognized gender-based violence as a public health issue, especially after the event of COVID-19 during the lockdown. We experienced a lot of, should we call it, an upsurge in cases of domestic violence, and because of this, it has been categorized as part of the pillars to actually consider during epidemic preparedness and response pillars, response project. So of course, it's actually the gender-based violence is actually much more domiciled under ministries of women affairs in the country, but because of their importance, like I said, it has now been included as a public health issue. So GBV, gender-based violence, has a significant and long-lasting impact on physical and mental health, and that's why it has been included as a pillar under public health preparedness and response plan. And because of the physical and mental effects that it has, such as injury, unintended pregnancy complication, sexually transmitted infection, depression, and other things, including death, we have to actually consider them whenever we are preparing or getting prepared for epidemic issues, epidemics or emergency issues in the country. So, and of course, providing quality healthcare services for survivors of gender-based violence is very critical in any crisis, such as during the lockdown. And the role of healthcare workers in addressing GBV is actually very crucial to ensure life-saving care for women, children, and other groups that are at risk, such as the elderly. And healthcare providers are not only offer immediate medical attention but can also link GBV survivors to other needed assistance, such as psychological evaluation, mental care, social services, legal aids, and also livelihood support. So most of the time, health care provider address GBV issue to ensure that most of the GBV survivors have access to point of contact so that they can give them treatment and also escalate their issue. So what are the ways to address gender-based violence using a system approach? Well, because gender-based violence cuts across a lot of, should I call it, sectors, we usually employ a multi-sectorial response, and this deployed to actually strengthen the health system response to gender-based violence. And the way to address it are going to be discussed just now. I'm going to list them, then we're going to consider them. Number one, we need to first understand the impact of GBV on health and well-being of women and their children. That's one of the first way to address it. We need to actually acknowledge it that gender-based violence has effects on the health and the well-being of women and children, and even men who are experiencing GBV. Also, we need to understand that improving healthcare workers and manager understanding of what GBV is will actually lead to a very effective response. Most healthcare provider always, I won't say sweep the issue of GBV under the carpet, but their focus need to be on GBV these days, and the best way to do that is to make sure that health workers and GBV managers have a proper understanding of what the survivors of GBV are going through. And to also ensure and strengthen the system response to GBV, it requires integrating care for gender-based violence survivors within the healthcare services. Okay, special attention needs to be paid to GBV survivors, and by doing this, space should be created for them within the healthcare system. Like we said, they need more than just physical attention. They also need mental attention. They need a source of livelihood. They need other aids that like legal aids that can really assist them, and also supporting long-term efforts to sensitize and train and support health professionals to be able to provide safe and effective response for GBV survivors is also very necessary. And of course, we need to be ready to address and support provider through examples and through enacting laws and policies that we assist the survivors to be able to live a normal life after, after being rescued. And the last one is that adequate documentation, monitoring, and evaluation of services for GBV survivors should also be ensured, so that as the survivors are being treated, as they are being attended to, this documentation will assist in future planning, and monitoring and evaluation of these services should be carried out so that the loopholes that are present in the system will be addressed, and then the GBV survivors will be able to live a normal life, and all the lessons learned will be applied in future and subsequent cases of GBV cases that we'll be having. So that will be all for now. The article for this talk will be attached with the post that will be made with it, and you can also reach out to any health care facility, because presently there have been a lot of efforts to link Those we refer to as social safeguard officers in local government levels. We've successfully linked them with health facilities. So there's always a gender desk, a gender-based violence desk at every local government facility. So if anybody is experiencing GBV, you can walk to any health facility you report. Once you report, the social safeguard officers in that same local government will be contacted, and the case will be taken up so that the patients, the victims, the survivor will be well attended to. So you can walk into any LGA, you can walk into any health facility and demand to be attended to. And of course, there are so many ways these people have been trained. In fact, there are so many trainings that have been carried out for both health workers, for social safeguard officers, for gender desk officers, and even state ministries of health and state ministry of women affairs to address all these particular issues we've been talking about. So we want people to take advantage of these facilities and trained personnel so that we will have a reduction in gender-based violence in our environment. Like I said, GBV has been recognized as a public health issue, so we are taking it as serious. So all systems have been activated to actually address all these issues. So till next time that we'll be having another About Talk, make sure that you stay safe. Now, the staying safe is not actually you avoiding infectious diseases, as is my usual way of rounding up my talks, but the staying safe also involves you staying away from violence, gender-based violence, and also adequately reporting gender-based violence that you witness around you so that we can take actions. So the next time we'll be saying stay safe and have a beautiful day ahead of you. Bye bye.
Feel my vibrations, your legs will be shaking.